What's really exciting about the Ely Area Community Care Team is that it brings both support and resources together in a variety of ways.
It is a collection of our local agencies. Some of them are county government agencies, social services. Then there's our school, our hospital, clinic, nursing homes, but then what's really exciting is lots of nonprofits.
But it's also support and resources for the service providers to know they're not in this alone, and they know how to connect the individuals they work with to the services beyond their own doors and make sure that the person with complex needs is getting the full range of care.
Many families just stopped trying to find the services they needed because it was so complicated to navigate.
I don't ever have a sense that one agency or one group has more say or more power than another. They simply have another aspect of care that they bring to the table.
The general feel that I get from meetings where the need for a plan is presented, and all of a sudden from all sides of the room people are making recommendations about things that we need to focus on and how do we solve these kinds of needs.
The reason for people to come to the table is that they recognize that instead of working with families or individuals on their own on a particular isolated issue, if they come to the community care team, they'll be able to access the resources of all the other nonprofits and groups and clinics in town and be able to provide so much more.
Even our county agencies didn't fully understand the breadth of programs available in the different departments. We were just so quickly much better able to find resources for families that really needed it.
The time frame of when they would see the doctor and get a referral would be months. Now we're down to, it can be a week or 2 weeks. I mean, it's amazing.
We're patient-centered, so really focused on the person meeting their goals and what they want and need to improve their life and their wellness.
The building of relationships and people knowing who people are is a huge success.
It's easiest to think about the clinic doctor who sees you for an appointment and hears you say you didn't have enough food today. But to think about that doctor then turning around and helping connect you to that resource, it's nearly impossible. But for them to make a quick note and a referral and know that they can count on that person will have access to food often within 24 hours, that is an incredible addition to their health and wellness needs.
It just gives them hope, basically, that they don't have to do this alone and they can make it through tough times.
Having a big discussion among all of the providers has just been so valuable in understanding what our community needs, and often not very difficult ways that we can improve, and there should be more community care teams.